We'll do that, please.
My name is Michael Chorny. I work at the Children's Hospital of Philadelphia, and I'm going to talk about targeted delivery of paclitaxel to injured blood vessels with magnetically responsive nanoparticles for preventing in-stent restenosis. But first, I would like to say just a few words about obstructive vascular disease and the way this condition is treated today clinically. So, obstructive vascular disease is a condition that develops as a result of plaque buildup in blood vessels, and when this occurs in the coronary arteries supplying blood to the heart muscle, this obviously creates a serious and potentially life-threatening condition. So the way this condition is treated today, a catheter is introduced through a peripheral blood vessel. It's advanced to the point of obstruction. There, a small balloon at the tip of the catheter is inflated. So it becomes extended. A small metallic scaffold on that balloon, called stent, is deployed in the artery, as is shown here, and this helps to maintain the lumen of the artery open for blood flow. Then the balloon is deflated and removed, but the stent stays in place. So this technique is called stent angioplasty, and it's actually quite helpful. One problem with this technique, which is the method of choice today, is that it, in a number of cases, in a relatively large percent of the patients, results in a secondary condition called in-stent restenosis. And this, as is suggested by name, actually means re-narrowing of the blood vessel. This time this happens as a result of scar tissue formation, and this condition is, in fact, more difficult to treat, less manageable than the original obstruction. And this is shown on this slide. So here we see a slice of an artery which was treated by stent angioplasty. You can see the stent struts here. And this actually defines the dimensions of the vessel lumen which were available for blood flow initially right after the procedure. Now, sometime after the treatment, we see that the lumen has gone down to these new dimensions, and this is as a result of the scar tissue formation, as I mentioned before, which is primarily composed of smooth muscle cells and extracellular matrix, which is generated by those proliferating smooth muscle cells, and this new layer is called neo-intima. So in our lab, we're exploring a new experimental approach for treating this condition, and this one is called magnetically targeted drug therapy mediated by magnetic nanoparticles. So this approach potentially has a number of advantages as a therapeutic strategy. It allows controlled drug release kinetics. Now, in comparison to existing technologies such as drug-eluting stents, other important advantages are the possibility of individually optimizing drug dose regimens, using drugs in combinations, because in some particular cases, some particular patients could optimally be treated with a combination of drugs rather than just one select drug. There is also a possibility of multiple drug dosing, and this is important because drug-eluting stents, for instance, once the drug is depleted, there is no more drug left, and if this doesn't cover the critical period of the disease, then this did not actually result in a therapeutic outcome. So replenishing the drug after depletion is something that can be achieved using magnetically targeted drug therapy. So how do we do that? There are two primary components to our approach. One of them is, as I mentioned, magnetic nanoparticles. These are supposed to be biodegradable, non-toxic to cells, highly magnetically responsive, have submicronial size which is compatible with parenteral administration, be efficiently internalized by target cells. The second component is a magnetic field source. Now, this magnetic field source should ideally provide a strong and far-reaching magnetic field, because what we want to do is to treat non-superficial sites in the body, like coronary blood vessels. At the same time, if we look at the formula for the magnetic force, we also need a high magnetic field gradient at the target site. Now, these two conditions cannot be met simultaneously by any existing permanent magnet. So the traditional approaches where such permanent magnets are used to target particles to sites, they are very easy to give good results in small animals like mice. But when we talk about scaling this up to humans, any of those traditional approaches in fact wouldn't do, because these two conditions just cannot be met by any of those. So in our lab, we're looking into an alternative strategy, which we term uniform field controlled magnetic delivery. And in this case, what we do, we actually just divide the responsibilities. So we use an external source of a uniform magnetic field. By itself, it doesn't create a magnetic force. Now, such sources are clinically available. It might be an MRI scanner, it might be a catheter guidance navigation system, paired electromagnets. What they actually do, they magnetize nanoparticles, and at the same time, they induce strong magnetic field gradients on a magnetizable implant, the secondary magnetic field source. And this might be a stainless steel stent. So this is shown schematically here. We see an artery. It's implanted with a stent. Here are stent struts. A uniform magnetizing field is created across the stented region. This uniform field magnetizes the magnetic carrier. Since the magnetic field is deep penetrating, the magnetic carrier can be magnetized basically at any location within the body, as well as the stent. So the magnetization of the stent and the magnetic carrier switches on the magnetic force, and the magnetic carrier is attracted to the stent struts and is retained in the stented area, exactly where we want the therapy to go. So as our model drug, for our experiments, we chose paclitaxel. Paclitaxel is a compound that binds to beta-tubulin, promotes the assembly of abnormally stable microtubules. Through that, it prevents cell division. I mentioned before that this scar tissue is primarily composed by proliferating smooth muscle cells, so we in fact want to control the cell division. So it rests the cell cycle. It can be both cytostatic and cytotoxic, depending on its dose on arterial smooth muscle cells. And its anti-restenotic effect has been shown when used in drug-eluting stents. So chemically, this is a small molecule. It's soluble in organic solvents, practically insoluble in aqueous solutions. Another component of our nanoparticles is polylactide. So that's a polymer of lactic acid. It's synthetic, non-toxic, it's biodegradable. So due to its biodegradability and safety, it has been approved for formulation of injectable drug delivery systems. Now, again, for our studies in our lab, we synthesized a conjugate which is fluorescent label. In this case, polylactide is shown in conjugation to a red body peak. We have synthesized a series of conjugates, actually spanning the entire body peak family. So, and these were used for uptake and biodistribution studies. So how do we make those paclitaxel-loaded magnetic nanoparticles? This is a three-step process. In the first step, an organic dispersion of mixed iron oxide, that is magnetite, is formed first by alkaline precipitation, then coated with oleic acid, which enables its dispersion as fine suspension, in fact, organic magnetic fluid in organic solvents. In the next step, this organic ferrofluid, in combination with polylactide, the particle-forming polymer, and paclitaxel, are emulsified in water in the presence of the surfactant. The solvent is removed, and solid nanoparticles are obtained. Finally, these nanoparticles are then purified from unbound substances by several cycles of magnetic decantation. So, the nanoparticles that are obtained through this process have a paclitaxel loading of about 4% by weight, magnetite loading around 40%. Morphologically, they look like this. This is a transmission electron micrograph of these nanoparticles. As you see, they're near spherical in shape. Another important feature of these nanoparticles, as you see, they contain a large number of very small-sized magnetite nanocrystals. And this is important because this creates the unique magnetic properties that I will mention in a second. So the size distribution, as you see, is very narrow, around 260 to 170 nanometers. And this very narrow size distribution is actually achieved through several size selection steps included in the formulation process. So here is the magnetic behavior of these nanoparticles. Now, the pattern of their magnetic behavior is described by the word superparamagnetism. That means that these nanoparticles become strongly magnetized when exposed to a magnetic field. In fact, a near maximal magnetization is already achieved at a relatively low field, which are easily created in clinical settings. Now, these nanoparticles do not retain any of the magnetic memory. That is, when the magnetic field is removed, the magnetic moment goes back to zero. They do not behave as magnets anymore. And why is this important? Because we obviously want to address the simple safety concern. We do not want to create irreversibly aggregated nanoparticles which can block small capillaries. So the ability to restore the original particle size, the particles lose their magnetization, they go back to their original dimensions when the magnetic field is removed, is important for safety reasons. So the drug release kinetics were measured using an external sink method that was also optimized in our lab. So this is a two-phase system. Paclitaxel, as I mentioned before, has negligible solubility in aqueous solutions. So in this case, we took a separate phase which is composed of heptane and 1-octanol, in which paclitaxel solubility is high enough for the particles to release the drug under satisfactorily met sink conditions. And here is the release profile of these nanoparticles. As you see, there is a rapid release phase where about 50% of the drug is released in about 5 hours, but then the release becomes slower and the drug is released over several days. In the next set of experiments, we wanted to see if those paclitaxel-loaded nanoparticles can actually exert inhibitory effect on the growth of vertebral smooth muscle cells. And for this, we used a system which models the high gradient conditions which the particles can experience in vivo. This system is shown here. So cells were seated on a plate at about 5% confluence and exposed to these nanoparticles with or without a magnetic field for 5 minutes. And then their growth was followed for 7 days. So as you see, when the cells were untreated, not exposed to any nanoparticles, they reached near confluence. Here you see that we used calcium as a cell viability marker, which stains only viable cells. The same is right for cells treated with just blank nanoparticles in the presence of magnetic conditions, nanoparticles containing no paclitaxel, or paclitaxel-loaded nanoparticles applied without the magnetic field. But the situation becomes dramatically different when paclitaxel-loaded nanoparticles are applied to cells in the presence of a high gradient magnetic field. And these results are shown quantitatively here on this slide. So, as I mentioned before, blank nanoparticles applied to cells in a dose range which is equivalent to that of paclitaxel-loaded nanoparticles do not quite affect the growth kinetics of cells. Free paclitaxel or magnetic nanoparticles loaded with paclitaxel but applied without the magnetic field show some effect on the cell growth. However, nanoparticles loaded with paclitaxel and applied in combination with the high gradient magnetic field cause near complete inhibition of the cell growth within the entire studied dose range. So the mechanism of the cell growth inhibition was addressed in this experiment. We compared paclitaxel-loaded nanoparticles to free paclitaxel. In all cases, we admixed a fluorescent paclitaxel analog at a ratio of 1 to 1,000 to paclitaxel. In this case, the particles were formulated with inclusion of a green fluorescent polymer, and magnetic conditions and non-magnetic conditions were applied. So as you see, the only situation where a substantial association of the red fluorophore is found with the cells is when a paclitaxel was added in the form of paclitaxel-loaded nanoparticles and in the presence of the magnetic conditions. Now, the localization of the red fluorophore corresponds well to that of the green fluorophore of the nanoparticles, which in turn shows co-localization with the cells. So basically, the mechanism is making more of the drug available to cells through applying the magnetic field. So this is the scheme that I have already shown, which illustrates our approach. Now, in our in vivo experiments studying magnetic targeting of nanoparticles to stented arteries, we used a rat carotid stenting model, which was adopted and optimized in our lab for magnetic targeting experiments. And it is shown schematically here. So an animal was positioned between two paired electrode magnets, which created a uniform magnetic field across the stented area. So again, the uniform magnetic field magnetizes the stents, magnetizes the nanoparticles, creates the magnetic force which drives the particles into the stented region, and the particles are accumulated and retained there. Nanoparticles were delivered for 30 seconds to injured carotid artery segments with or without a uniform magnetic field of 1200 Gauss. The magnetic field was maintained for an additional 5 minutes. Nanoparticle-associated fluorescence was assayed in rat tissues 5 minutes, 2 hours, 1 day, and 5 days post-surgery. Instant-free stenosis was determined by computerized morphometry 2 weeks post-surgery. The results of the nanoparticle targeting as shown here, so the most important finding is actually that the amounts of the red fluorescent nanoparticles associated with either the stent or the artery 2 hours and 24 hours after delivery in the magnetic treatment group are substantially higher than those that we saw in the non-magnetic control animals. Basically, the nanoparticles are almost undetectable. Quantitatively, again, these results are shown here on this graph. So, as you can see, the magnetic delivery resulted in a near 1 order of magnitude difference between the levels of magnetic nanoparticles in the target tissue that remained for 5 days after the treatment until 120 hours post-delivery. So, for comparison, the levels of these nanoparticles that we see in peripheral tissues, liver, spleen, and lungs, 2 to 3 orders of magnitude lower than the peak levels of nanoparticles in the target tissue that we see with magnetic delivery. Now, these results translated in a significant anti-restenotic effect that we saw in this animal model. Now, in this experiment, we compared magnetic versus non-magnetic delivery of paclitaxel-loaded nanoparticles applied at 2 doses corresponding to 7.5 micrograms of paclitaxel or 0.75 micrograms of paclitaxel. We see that the anti-restenotic effect expressed either as neo-intima to media ratio or percent stenosis is there with the magnetic delivery, and when we use the high dose, it becomes statistically significant, so it's clearly dose-dependent. And representative arteries from the control group, that is stenting only, and the magnetic delivery group as shown here, so you can clearly see that the amount of neo-intima in the magnetically treated arteries that received paclitaxel-loaded nanoparticles is substantially smaller than that in the control animals. So I will just briefly summarize the findings. The feasibility of magnetically guided delivery of paclitaxel-loaded pulmonary carriers was demonstrated in the rat-tailed stenting model. 2-source magnetic targeting of agents formulated in magnetically responsive biodegradable nanoparticles greatly improves site specificity, translating into therapeutically adequate local drug levels in arterial tissue achievable with minimal systemic exposure. This approach can provide the basis for developing new, safer, and more effective treatment modalities for vascular disease. I would like to thank people from our lab who contributed to this research, acknowledge our funding sources, and thank you for your attention.